Well, tonight we want to bring you the third part of Drugged, our week-long series on the opioid epidemic. Tonight we look at a group that has been particularly devastated by the easy availability of opioids, America's veterans. Jason Simkakowski was a husband, a father, and from 1998 to 2002, he served as a corporal in the U.S. Marine Corps. On August 30th, 2014, the 35-year-old died at a VA hospital. An autopsy showed that his corpse was laced with a lethal cocktail of 13 different prescription drugs, including multiple doses of 2 opioids. He never had a chance. He was a patient at the Tomah, Wisconsin VA hospital, a place so infamous for overprescribing painkillers that veterans referred to it as Candyland. Millions of Americans have been profoundly affected by opioid abuse, but the crisis finds its darkest expression in how it affects our veterans. Year after year, doctors at VA hospitals overprescribed opioid-based painkillers to vets returning from Iraq and Afghanistan. The drugs were prescribed so irresponsibly, the VA itself admitted that it was complicit in the growing addiction crisis. The VA deserves blame. VA doctors diagnosed 60% of vets returning from deployments in the Middle East with chronic pain. That compares to 30% for the overall American population. Until recently, the VA treated veterans' chronic pain almost exclusively with opioid painkillers. Prescriptions soared by 270% over 12 years, and easy access to the drugs led to sky-high addiction rates. But the VA failures don't stop there. In addition to getting tens of thousands of vets hooked on synthetic heroin, the VA has consistently failed to help them deal with their addictions. Consider the VA hospital near Fayetteville, North Carolina. That's not far from Fort Bragg, the nation's largest military base. 47% of the opioid prescriptions there are abused. Yet according to the Wall Street Journal, the VA health system in Fayetteville still has no residential addiction treatment program, no inpatient opioid detoxification facility. There are only 5 doctors in a 21-county area who are able to dispense medications to treat overdoses. The consequence of all this? Veterans either remain hooked on the drugs until they overdose, or they turn to private clinics. At one small clinic near Fort Bragg, hundreds of veterans line up outside nearly every morning for methadone, a drug used to treat their addiction. The line begins to form at 5 o'clock every morning. That tragedy is not confined to North Carolina. It's playing out across the country. American veterans are twice as likely to die from accidental overdose as non-veterans. Last year alone, nearly 70,000 of them sought treatment for opioid use disorders at VA hospitals. It's an addiction crisis far worse than anything ever experienced in American history. We contacted the VA for a statement. They acknowledged that opioid abuse is a serious public health issue, of course, and they said they've launched an initiative to reduce opioid use among veterans. They also said that more work needs to be done, obviously. Ryan Hummel is a veteran who took a job at the VA after just a few weeks